now, get some enthusiasm and share a few ideas. It's really to start the conversation. So just got a few things to share with you in slides and then pass over to Jazz if I can. And it is about greening care. And I think it's fair to say that it already is a care crisis, climate crisis. So we know that there's an impact on heat. We know there's a problem with poor air quality. People are anxious about the climate, and whether we like it or not, there's lots of toxic chemicals now in our homes, furnishings. Climate change resulting in flooding. So it's around us now. We're aware of it. We don't have to talk about it, but of course that impacts on the way people can live their lives. And although we often think about it being older people, it's not only older people at risk here. We need to look at the whole generation. And one thing I just wanted to make clear for us is that we don't always think about the actions that we take here, the impact that they have on other people. So I think it's looking wider, something we might do here. If it's not in front of us, it's not really obvious. If there's no drought here, would we notice? But some of the things we're doing are having impacts in other parts of the world on other populations. So there is an interesting element of social work, and I'm not a social worker myself, but social workers that I've worked with for many years absolutely are uniquely positioned to support individuals. And it's really important that they're looking at that, and they always do, in the context of their own place and their circumstances. Now, I have, as I've been digging around just for this this conversation, seen that there's been more and more written about environmental social work. It's a relatively new area of practice, but it's recognising the impact that actually the changes of the climate have on individuals. And I guess what we're really looking at in the care sector is about how we connect people, how they understand their circumstances, and how all of that connects back to the environment and their sense of place. Bottom line, I guess, is we're talking about removing waste from the system. We've got too much stuff and we don't really know how to get rid of it well. So I always say this is about taking waste out of the system. And when you look at the delivery responsibility for the delivery of the care sector, it does come to generally local authorities. And that's great. We've heard some great examples today where it's joined up in Devon and people are working together to try and increase their impact on delivering on the environmental goals. And there are even some councils, and here's one example where they're taking it really seriously in Oxfordshire, and I'm sure this would have caused a fuss where they're only serving vegan food at events, but you can see it's starting to get at people's agendas. But my background, as you may know, is from the NHS, and I wanted just to reflect a little bit on the NHS and its progress versus social care, because the net zero plan we've heard about has publicly stated it wants to be this first healthcare system in the world to become net zero, which is really ambitious, almost audacious. And although social care employs more people, it doesn't have a net zero plan yet. And why is that? There is, of course, because care is delivered through various local authorities, and that sometimes is passed on to other people under contract. 40% of the total spend of local authorities is in adult social care, but there can't be, almost by definition, a common voice like there is with the NHS. So what we're keen to try and do is look from the bottom up, but also how can we coordinate some of that environmental effort in the same way maybe the NHS has done. Because I know the care sector and colleagues within it are really keen to take action. So one of my questions today is, could we follow the example of the NHS? Could we adapt some of the work that's already been done as an approach for social care? And we'd need to start to think about how the care sector impacts on the environment. We should be able to calculate the impact of our services, but that might be at a micro rather than a whole system level. And then can we target our efforts on what might make the most difference to reduce emissions without at all impacting on the care? I think it would be both very important and fun. So here's something we prepared earlier for the NHS, and I won't bore you with all of this, but it's important for you to see that the sources of emissions by the NHS actually in social care and care generally is likely to have many of the same issues. With, if we had a bit of help, some of those we could more easily calculate. So I don't think we could get to this level of detail, but we could get some of the detail because we know some of the areas are similar, whether that's supply chain, as Janet's already described, or the costs of some of our buildings, the fact that we use waste and water, and obviously we've got staff and visitors commuting. So there are some similarities, and there are some ways that we could start to break it down into small manageable size bits. But yes, I'm going to hand over to you, and I'll move on the slides if you let me know.
Yep, that's fine. So just want to, first of all, thank you, Elaine, for starting us off. I just want to say that I am not an expert in this at all. The next couple of slides are based on like the last week or last few days of research. It's an area, so I think the reason that Adam and I have been brought into this conversation is because of the work that we've been doing with the People Plan for Social Care, which was published last year, and it incorporated, it was basically a plan for the sector by the sector. I'll let Adam talk about it in more detail shortly. One thing that we did include in that is that we wanted there to be green recommendations that we were providing to government and to individual providers for how they can make social care more sustainable. What the feedback that we got from the sector when we ran our 3-month consultation was essentially, we want to help, we want to do stuff, but we don't really know how or what we can do. It's like Elaine said, it's very fragmented. The NHS has a plan, social care doesn't yet, and so why don't we be the ones to create the plan for social care? I think the first thing is that it needs a bit of a mindset change. Like, everyone is very used to dealing with short-term crises, reacting to them, and it's a lot of firefighting. We need to switch to more medium and long-term planning, which is then obviously sustainable. It's also about changing from the mindset change of linear economy. So something is produced or a service is provided and then it's just obsolete after that, whereas circular economies reuse, recycle, we bring it all back into a circle. Elaine, if you could go to the next slide, please. So there are 2 main approaches to climate change. It can be adaptation options, or it could be mitigation. Both are correct. One will work for one provider, one will work for another provider, and it might be that one works for one provider at a certain point in time and another works for another, for that same provider at a different moment in time. So these are some of the examples. We will be sending the slides out afterwards. I'm really conscious of time, so I'm just going to skip through some of them as quickly as I can. Elaine, to the next one, please. So we didn't really know what the audience was going to be for this. I know that the first time I came to a meeting and someone was talking about scope 1, scope 2, scope 3, I was so confused and I didn't have a clue what was going on. So essentially, scope 1, 2, and 3 are a framework for measuring the emissions that are being produced as a result of climate crisis. I'm probably explaining it really badly, but so what we tried to do when we were looking into different examples that could be used in social care is try to make it very specific to either scope 1, scope 2, or scope 3. And therefore, when you are, if you are in a position where you are reporting on them and you're measuring them, you're able to do so. So scope 1 is basically your direct emissions. So things like you heating your buildings and switching from fossil fuels to renewable sources. If we move on to the next slide, which goes into scope 2. Scope 2 is essentially the emissions that result as a production of the work that you're doing. So things like running your Wi-Fi, your IT servers, your nurse on-call systems, your quality monitoring systems, that obviously requires electricity, and it's about that aspect of it. That a lot of reporting that is currently done across the economy, I would say, for lack of a better word, it focuses on scope 1 and scope 2, but actually the vast majority of emissions come in scope 3 because they impact the entire value chain. So that is basically anything and everything else that's not covered in scope 1 and 2. It's going to be things like procurement, waste management, water management. If we go into the next slide, please. So when we talk about the value chain, from the very quick research that we've done recently, what we've essentially established is that upstream is anything that helps you produce your good or service, and so the stakeholders, the suppliers that you'd be involved with. So one example of that might be working with suppliers who are signed up to sustainable and fair trade policies of some sort. Then your own operations are obviously what you yourselves are doing, and downstream is anything that impacts anyone as a result of your services. So for example, where we use cleaning products or laundry products and anything to do with PPE, at the moment that is made up of plastic and microplastics, which end up in our local and global waterways, which obviously contribute to water pollution, ocean pollution, and decreased biodiversity, which is something that's not great. And then next slide, please. So we try to come up with some ideas of what could fall into scope 3, and this is looking at a whole host of different options. We won't go into the examples too much over here. I think we'll come back to those later because you can read them for yourselves. If we can go to the next slide, please. But not all ideas require a huge amount of money. There are initiatives that are happening already in your local communities. And I think the beauty of social care is that it is an area where you're already embedded in your community. If you're providing care and support to someone, whether it's paid work, informal work, caring for a loved one, you are part of social care and you are involved in your local community. And so there are going to be initiatives that can be done, which other stakeholders in your local communities have either already started, or maybe they need your support to get a little bit further along in the process. Through to the next slide, please. So one of the things that John mentioned earlier is, how do we measure the changes? How do we measure carbon emissions? How do we measure the changes that we're doing? And so I can't promise that any of these will be the solution, but these are the ones that we found of different ways that you can measure different aspects of your various emissions that are coming out of social care. From what we understand, having done like very basic research on them, it's that they will help you provide solutions which are tailored to your individual organisation. So whether it's an NHS trust employing thousands of people, or it's a 15-bedded care home, or it's a home care facility, hopefully these will help you find tailored solutions for your organisation, but also for your local community. And you can see how you can tap into shared networks effectively. Next slide, please. Yeah, this is kind of what I've been saying. So the NHS is obviously a huge stakeholder, but there are so many other aspects within your local communities. Peter's already been talking about the schools and the colleges that he's been working with, but it could be local clubs, it could be local groups who are championing one cause or another. And when we were working on the people plan last year, one of the greatest aspects of it was that it was collaborative co-production. It was produced by the sector for the sector, and by that we meant people who were working in care, people who are leading in care, but also people who are receiving care. So similarly, we hope that a green plan for social care will have that same collaborative production, because that's what social care is great at. Next slide, please. Okay, over to Adam now.
Adam, I've got a few. Sorry, Adam, are you happy to pick up there? I've got a few more photos to just whiz through.
I mean, yeah, you can do. I mean, I can talk while you're whizzing through them if you want to, or looking at the time. I think for me, I mean, I agree with everything Jazz said and everything that's been said so far today, but I want to bring it down to the basics, and, and I want to think about what we can actually do right now to bring this change in social care. Jazz has already said, most people are involved in social care no matter what. I'm a firm believer, I'll take that further, I'm a firm believer social care is actually more than your care homes and people working in social care, your unpaid carers. Social care is everybody. As soon as we walk outside our door and interact with society, we're part of social care. When we recycle at home, we're part of social care. Social care isn't just about delivering care within registered care settings. So I think for us to think about a greener model of care, we first need to think about what do we do as a society and how committed is society to recycling? Because if society is not going to be a greener community, and we're not going to be that committed to being green, then how can we then ensure that that's going to become a culture within our settings? So there needs to be something about an understanding that when we try and make social care a greener sector, unlike health, where health is, health is health, health is its own individual sector, and it is pretty much cut off from everybody else. I'm sorry if I've annoyed anyone from health today by saying that, but social care for me really is interwoven everywhere. So how can we encourage people to live greener lives before we actually encourage a greener social care sector? And that's something we need to really start considering. So when we talk about education and training around greener options, it needs to be more than just, this is how we can provide greener care in our, greener support in our care home. This is how we can become more sustainable in our care home. This is what you can do at home. This is what you should be doing at home, because if we can make it a culture at home, we're going to make it a culture within the sector. And if we can make it a culture within society, then in turn, we're fixing social care on the wider aspect, because the newer generations are what's going to be making up the workforce moving forwards. We're also keen to learn from the people who are currently receiving care. So we need to be encouraging those who may employ their own carers to go, look, we know you recycle, but your carers might not, that you're employing, the care professionals involved in your life. So we need to look at how we can, on the whole, encourage people to become more sustainable. Otherwise, social care is always going to struggle. And there's things that we can do, and there's things that we need. I mean, since the pandemic started, let's look at PPE for starters. 8 million tons globally have been produced from PPE waste since the beginning of the pandemic. And we can sit here and talk about how we want to be more sustainable and we want to put solar panels on our rooftops. But simple changes towards PPE can change. Now, I know the NHS and the government are looking at recycling PPE, and I know they're looking at using medical grade face masks and visors to potentially turn them into curtains and other things. But we've got to lose some of our hypocrisy of going, we must be a greener sector, when actually we're producing tons and tons and tons of plastic each year as it is. And all it takes is for us to go to the government and go, look, actually, we're really behind this recycling of the PPE. How do we get there faster? How do we get there sooner? I know Jazz has already mentioned it, and it's something I mentioned on Monday. The problem isn't within social care. The solution is within social care, and we all have the power to bring that solution moving forwards. It's just, how are we going to do that? What are we going to do about it? And when are we going to start acting? We can sit in conferences and talk about it, and these conferences are great to raise the awareness, but where's the action? We do need a plan for greener care, and we can all be a part of that. We've created the people plan from the voices of the sector, the people who use social care and the wider community, and people have listened because they like that action. Social care hasn't had this investment. It's fragmented. There isn't that infrastructure in place. But instead of waiting for that infrastructure to come, we can actually go, let's do something now and bring a greener sector for the future. Otherwise, we're all going to struggle. So basically today, I just want to learn more. I just want to know what people think we can do. And in fact, I tell you what I'd be really interested in. If everyone can put their hands up, who recycles properly at home, washes out the tins, the pots, takes the paper off the glasses. If you can't got your camera on, put your hand up using your little emoji thing. In all honesty, every single time you use a piece of plastic, paper, cardboard, you order a pizza, it goes in the general bin, not the recycling bin, because it's got fat oils on. It's difficult, it's hard, and it's a culture shift we need to bring. And I think we need to encourage to say to people, look, we're never going to get it perfect. We're always going to make mistakes. And there's got to be something about being able to own not being perfect in greener care and actually go, we're going to learn as we go along. So I'm just happy to learn more and hopefully as part of the people plan, maybe a separate plan, Jazz. We'll get some reports going with Elaine, maybe. Produce a plan on how we can approach producing a greener culture within care.
Yeah, I think it just goes back to, it's like Adam said, there's the individual aspect, but then there is the sector change, is that mindset change. And social care is so great at being part of its community. So let's use the things that social care is already good at doing and use that to drive change forward. I think everyone on this call, obviously, like, they care about green care, they care about wanting to make the the world a more environmentally sustainable place. And now, I mean, Elaine, do you want to talk about the Green Plan and the Green Special Interest Group?
Yeah, I'd love people to come and join us with their ideas, because I think that's what's important. It's now, thank you, Adam, that call to arms, that call to action is really important, because we want to be able to take action. I think the time for talking about, you know, what we might like to do is gone. We actually need to be quite active and to do some things. Now, they can be really small things. And I do agree with you, Adam, that they can be a very personal thing. You know, there are some people that are saying, just don't eat a bacon sandwich before lunchtime. You know, I mean, whatever it is, don't beat yourself up about it, but do try and do something positive. Because we didn't talk about it too much, but there is a bit of a sense of helplessness that you do become a bit overwhelmed with this. And again, the care sector is very aware of that and helps a lot of people in that way. But there's nothing like feeling positive, because you're either doing something positive for yourself, or even better, doing something positive with and for your community. And that sense of place, sense of community absolutely needs to be where we need to go with this, I think.
You can make it fun. You know, when we talk about things like this, it's always very boring and very dull, and it's slides and it's percentages, and, you know, majority of social care on academics, you know, and that's no disrespect. They're still an incredibly skilled and professional workforce. They're just not academics. And learning about being greener in social care can be so much different. And we don't have to be waiting for new innovations to come along. You know, shove a Google Home and an Alexa system in your care rooms, set all your lights to go off at different times, or set your computer systems to shut down at certain times, save yourself money and electricity that way. But you've also got yourself a really fun, smart system within your building that you can interact and provide independence and more well-being for the people that you're supporting. You know, recycle your plastic, and if it's plastic that can't be recycled, don't just shove it in the bin, turn it into plant pots. But then you've got another activity and occupation within gardening. You know, it's about thinking outside the box and not just thinking of greener care in the linear sense that we're going to become more sustainable. We're going to become more sustainable and have a really good time along the way and improve the quality of life as we do it. It all lends hand in hand.
I'd agree, Adam. Sorry, I got to mention the hen power, Jazz, because I think that was my, you know, prize slide that I managed to find. The fact that people are being looking after hens and having eggs in their own places, but also that sense of taking care of something and being part of the community and bringing the kids in. It really is that sense of everybody doing something together, which can be really, you know, really helpful and helps the planet at the same time.
Yeah, and also I think there's so many actions that can be taken which have double, triple benefits. It's not just helping the environment. Like, say if we take uniforms, for example, at the moment they're mostly made out of polyester, obviously not the greatest of fabrics in terms of renewable materials. If uniforms were made out of bamboo, for example, it's much better for the environment, but it also has the added benefit that it's a cooling fabric. So where you've got a workforce that's made up of 80% of women, I'm guessing 50% of those are at an age where they are about to go through menopause, have just gone through menopause, are going through menopause, then you've got that dual benefit, and it'll benefit the men as well, because if you're working in a care home or in someone's house where it's really hot, the buildings haven't been updated to deal with renewable energy just yet, then, you know, that's a cooling fabric for them as well. So it has multiple benefits, and I think it's about thinking of how we can approach things with that multi-purpose angle.
I would go one further, and part of for those that don't know, I'm an ex-registered manager, home care provider and elderly residential home. And part of our personalisation, part of our person-led approach, part of our ensuring that the care we delivered was actually owned by the people we were delivering it to, we got rid of uniforms. It was greener because we weren't having to purchase shipped in uniforms from anywhere else. There wasn't that transport of them. There wasn't that constant overturn of them. And we just got rid of them. We went to normal clothes because it was someone's house that we were working in at the end of the day, because it was a care home, but it's their home. And we took away that authoritative nature. We had huge consultations about it. You know, we spoke to family and people we were supporting, etc. But that in itself reduced waste. because we didn't have to order X amount of uniforms to be able to put an order in because we were using a bespoke colour, and they didn't have all that extra plastic packaging in that we were ordering them in, or the fumes created when they were being delivered. You know, so it really is about making sometimes drastic changes that are just simple and offsetting your carbon footprint that way as well. So there's so much we can be doing, and we need to be learning and listening to other people and hearing what they do. So, you know, meat-free Mondays, people do it at home. So why don't we do it on care home menus? Is there a way that we can make our menus more sustainable? Shopping locally, making sure we use locally sourced vegetables, meats, produce is going to reduce our carbon footprint. You know, it's little simple things like that, but it's not stuff that we comprehend as managers because we're run off our feet most of the time, and it's not embedded within society. We're a society of convenience. We're a society of wanting to just be able to go on and, Jazz, I think we spoke about this on Monday, just order everything off Amazon because it's there and it's available, you know, sometimes shipped internationally. And we need to shift our convenience mindset to something that is more sustainable. It's just, how do we give up convenience? You know, convenience is nice.
So Adam, John was right. We will just rattle on all afternoon. So we should listen to what other people. And I think I saw Lorna's hand up with a question maybe, or anybody else? Any questions? Or reflections or comments?
Yeah, I'd like to offer a
please.
Probably. So I'm a care home provider, elderly residential, and also I was going to say work, but I volunteer as a sustainability lead for Devon Care Homes Collaborative.
Great.
Your comment, Adam, I was really taken aback and thought, gosh, that's a really good point. We're such a fragmented sector. How do we get this message out to our staff and our membership? So we've got about 70% of the care homes, Devon, Plymouth and Torbay, but getting it out there, which is a very fragmented market, lots of individual homes, and then getting a consistent message to have that shared language and shared understanding. And I think you're right, you know, you have to approach it almost as a person, as an individual first. What I struggle to find, and what I would love to have any support or ideas or work with you, would be actually, can we just get some really simple training videos out that all of our membership could use? I'm trying to find a small pot of funding. It won't take a lot, and I don't think it needs to be overcomplicated. Because if we could roll that out and then roll it out nationally, you know, perhaps it just makes a small difference, but it's all of the small differences that then add up. So it sparked a train of thought. Thank you. And Jazz, thank you for your comment about uniforms. Why didn't I think of bamboo? You know, but it's the sharing ideas, isn't it?
Yeah.
Thank you.
Exactly. Like there's been so many times where someone said something, whether it's related to green care or something else, and that's then sparked off like a million different ideas in my head as well. The problem is trying to get them all down on paper before I forget them.
I'll say I've got 10 fingers and they're in about 40 pies at the moment, but I'm pretty sure at the IHSCM, as part of our Greener Care group, Lorna, we can put something together around, you know, simple. I mean, before the pandemic really took hold, I just did a 5-minute video on how to don and doff PPE, and it was used by hundreds of managers around the country until the NHS could actually produce something that they could use. So, you know, someone's got to do it. Someone's got to go first, even if it's just us talking about ideas and putting it out there. You know, we can do something and we can get that voice out there and we can try and unite them.
I mean, just going back to the people plan and what we did last year and what we're doing this year is, it's not just a report that we put out and we said that's it. So we've had our 3-month consultation, we've done our desktop review, now it's just going to sit on a shelf. We wanted it to be an ongoing process. We wanted it to be the start of the movement. And so what we've organised is roundtables that are happening for 6 months of this year. We've had one already, there's 5 coming up, which are about the 5 individual sections of the people plan. But there's a survey that's going to be running for 6 months. There's going to be a consultation with the sector. There'll be another report that's published at the end of the year. And we started that last year basically because we were frustrated that not enough action was being made or was being done. So we're like, okay, well, why don't we we've got so many providers and so many people who work in care, so many people who are receiving care who have all of these great ideas. Let's just put them all together in one place. And it's the first people plan for social care. We haven't had one prior to that. So I don't see why we can't do the same with green care and with creating a green plan for social care. I know I'm creating work for Elaine and the Green Care Special Interest Group.
Delighted to have it.
I mean, like, thanks to John, Adam, the Institute, we were able to do this with the people plan. And I just think it'd be lovely if we could do something similar for creating a green plan for social care. The NHS has one. Let's create our own.
Yeah.
Can I just put our feet back on the ground for a moment then with Chris's comment in the chat there, because it's an important point about costs and not passing costs onto our staff who often feel that they're struggling already. I don't know, Adam, if you've got any thoughts about that.
Yeah, it's so difficult, isn't it? You know, because I will go to, I mean, I do online shopping now because A, trying to trim, and B, trying to save money. So I do like a monthly shop and it all comes, and it's great because I'm not tempted by everything else that's in the supermarket. But if I go to the supermarket and I want to buy fresh produce and I'm going to go around, I'm going to go organic, I'm going to go local, I'm going to do this. You know, a pack of 6 tomatoes is probably going to cost me £2 more than a pack of 6 tomatoes that have been imported from Spain, wrapped in plastic instead of in a paper sort of punnet. So I think to myself, oh, I'll just buy the cheap one because it's easier. That this is something different, and it's something we're going to have to really tackle the government on, is making being healthy, making being sustainable, making being better the same cost as not. You know, it's convenience, and it is this market of convenience. I can't get my head out of this market of convenience. We charge more to be better than we do to not be, basically, and we put environmentally friendly options behind a paywall. So the lowest paid in society, the people that we need to be supporting most, like our care workforce, can't be environmentally friendly because they can't afford to spend £2.50 on 6 tomatoes. So it's how do we support people in a way that we make it better for them? I completely agree. Maybe we need to create initiatives at work. Maybe we need to be able to offer food compensation as part of our pay packages so that people can make environmentally friendly options. I think the people plan addresses a lot of issues when it comes down to pay. And if we could actually just increase the pay for the workforce, things probably would be better. But yes, no, I completely, and even for businesses, you know, it's about encouraging businesses to make those options and make those choices without it being too cost effective to them. And again, I think it comes down to training. I think it comes down to budgeting, and I think it comes down to showing people that actually being smarter on budgets can benefit you. It's just a different way of thinking. But I think without tackling the idea of convenience in the world, there's nothing major, personally, I think we'll be able to do to stop people from shopping on Amazon. I shop on Amazon. I'm a hypocrite. You know, I'm a hypocrite.
Well, we'll leave you with that final word there then, Adam, and we'll all remember that bit. So, John, we're right on time. I hope we've provoked some discussion and some interest, and we'd love you to come and join us, but we'll hand back to you, John.
Can I just add one final comment, please?
Of course.
I know that when we're talking about green care, there's obviously a conversation that needs to be had about cost, feasibility, the trade-offs to make it happen. I can't remember the name of the report, so I'll try and find that and send that out, attach it to the slides when we send them out after. But one of the ones that someone had basically gone and looked at organisations who had gone green in the last 20 years and found that over the long term, they were more profitable and they were more sustainable from a financial viability perspective than those who had not chosen green options of some sort. So if you are trying to change the mindset of decision makers, that might be an avenue that you can use. I'll try and find the name of the report.
Thanks, Jazz.
Well, there we are. Can I just say to the audience, you were fair warned before this section just took place that we've got 3 fabulous talkers here. And actually, I listened to all of that. I think just that was fantastic. I love the enthusiasm. I love the commitment. I love the debate that it's provoked. Let's have more of these, I think. And if we can get some more social care colleagues to join the Greener Care Special Interest Group of the Institute, then so much the better. Jazz, I think you've done it. Watch this space for a greener care plan for social care. It's coming.
Not just me, it'll be a team effort. It'll be
And
a
I
whole
tell you
community
what,
and sector-wide approach and effort.
We'll launch it at the House of Lords again. Don't you worry about that.
Thank you so much.
Another grand day out. Thank you. Thanks a million, Jazz and Adam and Elaine. Delightful.